one of my passions is inspiring other doctors to realize that it's not easy and you can still do it. And so that's one of my joys in life is being vulnerable to others to empower them. But at the end of the day, his palate is developed, and that's something that to me is the most important. He has good structure, he has good breathing, and he did not having symptoms. And this is the sad part for me. And when I feel special, like he drove 3.5 hours to see me. And that's why I'm pushing to teach other doctors to do this.
Good evening, everyone, and welcome. I am Lauren Gates, host of tonight's AHS Conversation, and this is such a special conversation because we're going to learn how Dr. Jenna Schwibner went from tooth-focused to foundation-focused, her airway dentist journey, a conversation with Dr. Jenna Schwibner. So welcome, Dr. Jenna. Thank you so much for being here tonight. I am so excited to share your story personally and hearing you now on the stage at Airway Palooza and seeing your foundation first facility almost ready to be complete and opened is such an inspiration that I'm really looking forward to sharing this with everyone else tonight. So thank you for joining us.
Thank you. I'm excited as well.
Thank you. So basically, we're going to just go over Dr. Jenna's story this evening, and then I'm going to give you a formal bio, and then at the end, we are going to do our raffle for the introduction to the foundations of pediatric airway with Dr. Ben Moralia, and you got to be in it to win it. So everyone stay to the end so you can join the raffle and be eligible to win that course. And if you have questions throughout the conversation, you can drop them in the Zoom's Q&A, and we'll be happy to answer them along the way. So we're really excited for this to be interactive after Dr. Schwibner does her presentation, so you can learn from her directly. We did have a lot of questions this evening, and we had over 500 registrants, so we're really excited to address some of these questions and get everyone maybe on their way to be an airway dentist. So Dr. Schwibner, I'm going to go ahead and give your formal bio to get started, and then we're just going to dive right into it, tell your story, and answer some questions. So Dr. Jenna Schwibner is a nationally recognized leader in airway-focused dentistry and founder of Foundation First Dentistry Education. She's the owner of Foundation First Education, Dental Partners of Vero Beach, and the soon-to-be open Foundation First Airway Center, where she has implemented comprehensive approaches to treating sleep-disordered breathing and obstructive sleep apnea for patients of all ages. Her comprehensive clinical expertise spans soft laser tissue palate lightening, tightening, laser frenectomies, interceptive and full scope airway orthodontics, and oral appliance therapies for adults. A passionate educator, Dr. Schwibner serves as faculty and speaker for Airway Health Solutions, Light Scalpel, and Awaken to Sleep, where she empowers dental and medical professionals to better understand and manage airway health. As a qualified dentist with the American Academy of Dental Sleep Medicine, AADSM, congratulations on that. She's a diplomat, and she combines cutting-edge science with compassionate care, positioning herself at the forefront of transforming lives throughout airway-focused dental treatments. So there is so much we can say about your journey, and I'm so thrilled to bring it to life. And I know we met back at the Dawson Academy. We're just having a casual lunch, and somehow I'll let you tell the story. So I'm looking forward to getting into that. But before we go, just a couple of disclosures and housekeeping items. This presentation is intended for educational purposes only, and the views shared tonight are based on the speaker's clinical experience and professional perspective. The conversation is not medical or dental advice and should not replace your own clinical judgment or decision-making. And for those of you joining for CE credit, please note that attendance is being tracked through the Zoom attendance report. And to receive your full CE credit, you must meet the attendance requirements for the session. The certificates will be issued after attendance is verified, about a week or so, and then post-event requirements are completed. So that will that's all my housekeeping. I'm excited to roll up our sleeves if we had any here and just begin. So, but just Dr. Schwibner, in your own words, why don't you just go ahead and share your journey, and then you can show us maybe some before and after cases that are near and dear to your heart, and then we'll open up for some Q&A.
Yeah, so thank you so much for having me. It's always a pleasure to be part of this. And It is growing so rapidly right now. This is a really fun time to be in airway dentistry. So doctors are popping up all the time saying they want to get into this, they want to learn more, and I'm so excited to be part of that movement. So thank you so much. So I think we're gonna just go right into kind of sharing my story here. I'm gonna share my screen. And I do have one special case that we talked about at Palooza, that we'll share. But I'm happy to talk more when we have time. I know we're going to be going over that a lot in the course this Friday, so um, there'll be a lot more of that this week. So you guys can all see that screen there?
Yep, you're good to go.
Great. So, like Lauren said, we met at the Dawson Academy, and I am trained as a general dentist. And my goal was always to be just the best general dentist you can be. Just like I'm sure every general dentist comes out of school and says, well, how can I get to the root cause of my patient's problems and really get to the why? And so that's been my passion and everything. It's like an investigator in a puzzle of how can we find the reason why patients have problems. And that can be as simple as asking your patient why you have a cavity. Candy, diet, and what we know now, mouth breathing is a big one of those. So things like that kept popping up that made it impossible to not realize that the airway is right behind the jaws. And so I think this picture is funny and interesting that it doesn't even look like me anymore. This is 2017. I was pregnant with my daughter, so a little bit bigger version of myself. But I got this award, and it's the Complete Dentist Award, and I was really proud of that. And at the time, I rushed to do all of this core curriculum at the Dawson Academy as fast as I could because if I know I want to do something, I do it as fast as I possibly can because I felt like that's what my patients deserved. If they deserved for me to know everything. And so I went through that and I said, okay, after I'm done with this baby, I'm gonna slow down and be home and not go to so much CE because I was driving 3 hours across state basically monthly to learn from these wonderful doctors in this picture because I wanted to practice complete dentistry, which at the time meant diagnosing and treating the cause, not just the symptoms. And that's when that verbiage first started. So when we were at the Dawson Academy, they talked about the muscles, the jaw joints, and how all of that is related, and how we break teeth 3 ways, or we lose teeth 3 ways, gum disease, cavities, or occlusion, right? It was all about occlusion and why we clench or grind our teeth. And then I finished my core curriculum, and the next step was elective courses. And we go to the alumni event, which is where I met Lauren, and then they had this elective airway course, and that was the first time I ever heard about airway. And these were some of the slides, and I found this funny because I know we all go to CE and we take photos of slides and then we never look at them again, or they go into the abyss and we're like, why are we taking these photos? But I remember when I was first putting together this presentation, I went back and I said, you know what, when did I take that course? And it helped me know, okay, this was the date of the course. And I looked back in my phone and these were pictures that I took at the course. And I'm like, I didn't even remember hearing this. Like, this is, it was just in my subconscious brewing. And these were photos that I took, it talked about the postural theory of malocclusion and how that tongue is resting against the palate and that's developing the jaws. It talked about form and function and that, unfortunately in Western medicine, we've kind of forgot these things and we're have this barrier to change and that in children, we need to identify deficient growth and underdevelopment. So this was stuff that I was hearing and I hadn't quite understood it at all. It was actually my husband. It was funny. He was sitting next to me because even though he's a financial advisor, he loved going to courses with me. And he said, why do we get crowded teeth? Why do we need braces? And I'm like, why are you, that's a weird thing to ask. Why are you asking that? And I always remember thinking that. And so right around that time, As you guys saw, I was pregnant with my daughter, and this is her as a baby at the bottom, and I had the my son up there, and they were growing, and I was watching their cute faces and those pacifiers in their mouths and those bottles that they had. And now you look at these pictures and it's cringe, right? We see the anterior open bite, the narrow palate, the low tongue posture, all of those things. And all my kids were really attached to their pacifiers. So I was learning this as a trying to be a better dentist, but then of course you're always wanting to be a better mom. And these two things came together to push me into asking why, what's the cause? How can we grow better humans? And my practice, mostly adult practice, how can I go back and go downstream and see who were these adults as children? And could we have prevented this? And that just kept going in my head. And then, yeah, you go to these conferences and you sit at a lunch table, and I happened to be sitting next to Lauren, who was there as a rep, and we were just talking, and it was so funny because once again, I didn't even really remember that we met until later. We're like, wait, we've met before, and that's kind of crazy. And so because of meeting Lauren and doing Ben's courses, I was able to take these kids with anterior open bites and underdeveloped palates and develop their jaws so that they could grow healthy. And they're all in different stages now. And so that's my oldest on the left, who was 30 millimeters. You'll see in a second, 30 millimeters transpalatal, no room for his teeth. And he hasn't had a brace on his teeth. It's just been jaw development and expansion to help him breathe. And then that daughter in the middle, she's already had her first set of expanders. We'll see how she continues to grow. And then that one on the right, he's in his expanders now. He wasn't yet in those photos. And they've all had their own journey. My only one that was really symptomatic is my oldest had some nightmares. We intercepted early. And my youngest over here, he's actually been battling with ADHD. And, so I see it from the mom side. And that, is no different. I don't necessarily need to go into this, but I had this slide just talking about, so my life wasn't so easy. I'm actually turning 40 next month. I'm a pretty young dentist. I rushed through everything in life. But through developing this practice, developing dental partners, and this Airway journey, I was faced with almost every roadblock you could. I needed to do IVF for all of my children. My children had pacifiers bottles. I wasn't breastfeeding because I had a mastectomy before my children were born, or before my two were born. And so I had a lot of medical issues. And the reason why I shared this previously at Airway Palooza was because one of my passions is inspiring other doctors to realize that it's not easy and you can still do it. And so that's one of my joys in life, is being vulnerable to others, to empower them to be able to do whatever they want to do and not be held back by the fact that you're a mom, not be held back by maybe you've had breast cancer, you had a mastectomy, you had multiple associates that didn't work out that caused your practice to struggle, because I've done it all. And I've had many sleep consultants or consultants, now a sleep consultant. I've had many practice consultants over the years that have helped me build a practice, a private practice, run a private practice, do all of those things, and make it through at the end to say that it was all worth it. So I hope to motivate everybody by sharing that sometimes, whenever I went to these courses, especially at the Dawson Academy, it was funny. I would look at their resume and then look at their family life. And I would say, can I do what they do? What did they give up to be great? And unfortunately, so many amazing doctors I found, they had divorce. They didn't have children. They were males. And I felt like, how can I do things like they're doing it when I have children and I'm a female and I have medical issues and I'm not willing to give up my work-life balance? How do I compete with that? And so I really hope that being a female who's young, who's gone through a lot, who has three children, and we're doing it, I hope to motivate others that says like you can do it too. So um that's my soapbox. So this is my oldest. So we were kind of seeing him progress from 2, 3, 4 when I really started getting into this. He went from this cute anterior open bite to a cross bite to open mouth posture. And this is when I was starting to see the nightmares and see the things that he wasn't sleeping well. And that's what pushed me down to look at one of those speakers that I heard, which was Dr. Ben, and pull out his resume and pull out his life and say, how can I be like him? Is he somebody that I can model after? And he has a wonderful family and a wonderful life and was a wonderful person. And I said, you know what? That's who I'm going to be when I grow up. So, so I started learning how Dr. Malia was able to help the children he was so I could help my own children. And so Ari was about 6.5 when I finally said, okay, we need to start expanding him. I didn't want to wait until he was even 7 or 8 because you could see he had no room for his teeth at all. So I jumped right in with him and some other patients at the time, and we just developed him from that 30 millimeters across to the 40 millimeters across that he needed to be. And he has some issues. He has a congenitally missing number 20, of course, because he needs to make my life more difficult. But overall, I'm really happy with the fact that his teeth came in relatively straight, with no major crowding, and we will do some clear aligners when he's responsible enough to wear them. But at the end of the day, his palate is developed, and that's something that to me is the most important. He has good structure, he has good breathing, and he did not having symptoms. And so that, is where I started. And now this is a child that I shared at Palooza that it's hard to pick just one, which is amazing. And I really could go and just show you patients every single day. It's not a fluke. Every day we have a patient that literally they say, you changed my life. And that is why I went from a thriving general practice that really was doing well financially, everything. I love general dentistry, but this is why I couldn't say no to airway dentistry, because you literally are changing lives every single day, and nobody else is, at least in our area, doing this work. So you have to do it. You have to help these kids. And so you help your own children, and then a child like Jaden walks into your office and he's struggling. And these are the symptoms that he had. And he was, you know, being told by so many specialists that, like, this is normal or you're fine, you'll grow out of it. And he was getting worse all the time. So you guys can read these things, but for those that might be listening and not looking at their phones, he was mouth breathing, gasping when eating. He had to like take breaths every time he was taking bites. He talked about not being able to walk down like a street or do a lap at school without really gasping for air. He was having nightmares every night. He was having irrational thoughts, headaches every morning, and anxiety. And they had taken him, considered going to a therapist, considered medication. And of course, he was recommended teeth extractions because he had severe crowding. And he was 14, so kind of on the later end for when we would like to see children. And almost every child that we see with severe crowding like this has the tongue tie, and he had that. So we were able to take the principles that I have learned through the courses I took at Airway Health Solutions to take a child like this with a tiny little airway, as you can see on the screen, really small, his minimum area of 57.6 millimeters squared, and the crowding, the vaulted palate, and not having a lot of tongue space, and he was having that deviated septum. So I think that's one of the things that you have a deviated septum. You think, oh, you got a trauma, you got punched in the nose when you were younger, but no, I mean that deviated septum happens with that vaulted palate because that nose has nowhere to grow. And then you have this child that's already mouth breathing. Now they have a deviated septum and they get worse over time. They really get worse and not better. They don't grow out of it. And this is the sad part for me. And and I feel special. Like he drove 3.5 hours to see me. And that's why I'm pushing to teach other doctors to do this because access of care is a real problem, and these patients deserve to be able to get care without interrupting their entire life because these kids are already struggling. And if you have a struggling child, you have a struggling family. And I'm really passionate about that, even though it may take business away from me in the long run. I think there's plenty of patients to go around. And I'm going to get teary because my kids have their own issues and it's exhausting taking care of a child that's sick. And to have someone like Jaden that's suffering, it broke my heart every time his parents had to drive with their other three kids and get a hotel to see me. And the financial barriers of that, I feel so bad every time. Like I do have some people that come from out of state to see me and they go by other doctors because I do have a name in this. But I don't want that. But when I try to refer to other people, they don't get treated as well as they need. And so we're working really hard to develop systems at Airway Health Solutions so that we all can be consistent and talk and share and just help our patients in a consistent manner because there's so many different ways to treat people and there's not a lot of consistency. And so with Jaden, we happened to do two sets of expanders because he was so narrow. We went very slow. I followed Dr. Moralia's protocols that he taught me, and this was pictures he took virtually. So, we're working on that with Airway Health Solutions, making a platform so patients can share pictures and we can see them virtually thanks to technology to help with access of care. I would much rather see the patient in person if we can. And what is great is if a doctor pops up that's close, we can make that referral over and transfer the care. I will be fine with that. I want these children to get care. So we try to make it easy by doing that. This is his second expander. We like using that super screw expander on the top. Which is really easy for patients. And once again, that's what we teach at Airway Health Solutions. And then after that, these kids become pretty straightforward, clear aligner cases. And so it's funny how people say you can't expand a lower jaw, and especially not at 14, 15 years old. But look at the change of that dental alveolar bone on the lower jaw, especially. That dental alveolar bone is in a totally different location than it was. Those teeth should be in his cheek, and they're not. They're in bone. They're in great bone. They're actually uproot. He has like less recession on those lower premolars because they're roots, so you're taking the roots of the teeth and you're pushing them down into the good bone. And then you're developing those jaws slowly. And, unfortunately, we're told, and I know my orthodontic colleagues are told you can't do it. And we want to do no harm. We don't want to hurt our patients and have them have recession and have them have problems. And so we're told you can't do it, but you can. And the only reason why I know I can is because I believed Dr. Ben when he told me I can, and I did. And I don't know, I think I might be a little bit more courageous and a little bit more prone to risk taking. But he showed me the cases in my first, year and a half of doing this. I had one-on-one mentorship with Ben. And so he said, nope, you can do it. And I was like, okay. And I mean, I had a phone conversation, I know Lauren and Ben, with one of my first cases that she was supposed to get premolar extractions. And I called them and oh my God, what do I say? I'm a second opinion from an orthodontist that I respect. And how do I save this child? And I remember Lauren said to me after they gave me a pep talk, they told me what to say. Lauren said, go save a life. And I think about that all the time. And she's another success story that I don't even show. And that's what we do. And so I'm hoping that I can give that motivation to other people of like, you can expand that bone. You can change the shape of the lower arch. And it's not that hard. You just need to learn the systems that we teach. And so once we create room for the tongue, we release that tongue into that space. I do the tongue tie releases as well because I don't have a release provider in my area. So I have gotten training through Dr. Baxter, through some other laser courses over the time of doing these releases in my office. Because once again, I try to make things as convenient and close for my patients, because if it's hard for a patient, they're not going to do it. So we're looking at, doing more courses on that in the center, and then trying to make it efficient. So 18 months of treatment, so two sets of expanders, tongue and lip tie release, and aligners. And he was only in the office 8 times, which for a child that had to drive 6 hours round trip with a hotel room, with a family full, that, they don't have a lot of money. That was still too many. That still cost too much money for them. So his sister needs treatment, and they can't get physically to me to get it done because life is too hard. So we need more people to do this, and you can do this. You can take a child from this to this in 18 months. And this is the view that I care about the most. So hopefully those of you that are listening, maybe look at your phone. This is his airway change, which we were blown away because once again, we were told this isn't possible at 15 to 6. He was 14 when we started, 16 when we finished. He was too old for non-surgical expansion. Like, this shouldn't have worked as well as it did. But it did. And they always know that, you know what? Surgery's my other option. And you know what? If the bone's not moving, we'll stop. So we watch them closely, but I've never had to stop on a teenager and say, nope, we have recession, or no, we have a problem. And we take CBCTs before and after. We see the bone that's still there before and after. It's incredible. And we see the airway change from 57 to 207. And when an airway changes like that, a child changes. And these are his symptoms. They're not there anymore. And now I follow him, which is so fun, right? I mean, get to, have these patients in your life. Like, he calls me and he tells me he's going to the Marines. And he said that he could never have passed that physical for the Marines if it wasn't for the treatment we did. He could not run before. He was not athletic. And now he's thriving. He's going to contribute to society in a big way. I hope he goes to dental school in the Marines and comes out and and works with me, because he is a different person and he no longer has irrational thoughts. He no longer has bad dreams. Sleep is now a safe place for him, where before he told me he didn't want to go to bed because it was scary. And I'm going to cry, but I had a 6-year-old in my chair 3 days ago. And he was crying and he was telling me, I don't like going to sleep because it's not safe. And I have dreams of being in a black hole. And I said to him, oh, you see this expander? And I showed him it and I said, this is going to help. I never say completely fix, right? We got to use our verbiage. I say, this is going to help get rid of some of those dreams. It's going to make those bad dreams better. And he gave me the biggest hug and he said, really, you can make those bad dreams go away? And I said, we are going to help. And we're going to make sure that we do. Because if it's not me alone, we're not going to stop till those bad dreams go away. And he was just like, oh my God, this is magical. And that's a 6-year-old. How, you can't go do a crown after that. I'm sorry. So this is the faculty that has helped shape who I am and continues to shape who I am. And if anyone wants to hear Jaden's testimonial or share it, take it, use it on your websites. I don't care. This is my link to this video. Lauren, do we have time to share it? I think it's like 5 minutes or 2 minutes.
I think it'd be great. I think it'd be great to hear from Jaden. It was so touching at Palooza that, if it's okay with him, we are streaming on Instagram and Facebook.
Let me make sure I hit share volume. Tell me if it is, and if not, I'll X out and put it back in because I was so excited to add it. I'm not sure if I did. Can you hear that?
No. So you can stop and then reshare. It's okay.
Sorry.
It's worth it.
Okay.
I remember there wasn't like a dry eye at Palooza. I have to
Share sound. Okay. I'm
thank you.
sharing sound. I'm sharing this. I'm getting better. If we go to my first webinar here with you, it'd be like, okay.
Absolutely. I feel like it's just for, you should have a glass of wine.
About a year and a half. He started at
Okay,
14
let's
years
go
old.
from the
Jaden's been-
beginning and try to get enough
He started at
volume.
14, doing treatment for about a year and a half. He started at 14 years old with us, and he's 15, and they come from pretty far away, close to a 3-hour drive. And so we're excited that he is finishing up with treatment. We did some expansion, 2 rounds of expansion, Invisalign, which we're just kind of fine tuning his bite right now, tongue tie release with Joanne at Myo Air, and lip tie release. So he's done all of that, and profile significantly improved.
Before, I was a completely different kid. Like, I was nightmares, anxious, snoring a lot, very irritated. Like, I would wake up, like, I would get no sleep. Then we found Dr. Jenna's office, Dental Partners of Vero Beach, and from the start, it was just a nice place. Staff were very friendly.
Airways were like the biggest issue for us because since he was little, he had night terrors when he was like a baby. So I didn't know, and I kept digging into like a holistic approach, something that wouldn't yank teeth and remove things that were healthy in his body to begin with. I feel like this has been the best thing. His airways have definitely improved. He doesn't snore at night anymore. He's not developing sleep apnea. Like he was progressively getting worse with it. I would walk into his room and see him not breathe, and that's horrible.
I was always skeptical from the beginning, though.
Yeah.
I have to admit, because they went to several different doctors, and every doctor was saying the same thing: remove the tongues, do this. It was always surgery, surgery, surgery. So when you hear multiple people saying the same thing, you tend to say, okay, let's walk this path.
I feel like my sleep is more like how it's supposed to be, peaceful, restful. Before, it was very, I would wake up in the night like gasping for air, and I would wake up with headaches a lot.
The top 3, this is where he started, and the bottom is where he is today. So we have a much bigger airway from here to here. You can see no adenoid inflammation, no tonsil inflammation, just a nice broad airway.
Right, that's it. I'm gonna stop sharing my screen.
Well, that's amazing. And I remember at Palooza, we actually had really the privilege of hearing Jaden's story firsthand, and he spoke so eloquently on the stage, 250 people, and it was amazing to see the confidence that he had and just how you really completely changed his life. And I love that you say that every day you change a life. So keep saving lives, doing a great job. You're an inspiration to me. I know Dr. Morale is actually on the call as well. So he was actually crying. I've seen him during Palooza. Really, really proud of the work you've done. So so glad that you're on faculty now. It's really full circle moment, and we can just pay it forward and help more kiddos and adults. This course you're doing is going to focus on the children, but we're also going to do a follow-up course with the adults. So thanks again for sharing that wonderful story. And I'm just going to take some questions. And if you have questions in the audience, you can just go ahead and use the Zoom prompt for the Q&A. But there is one on cue. What age would you not consider mandibular expansion?
So I'll do, we'll do expansion, dental alveolar expansion with clear aligners just about any age, so we use the clear aligners in a very controlled manner, and we can successfully, get expansion of the lower jaw. There obviously is certain limits when you're adult because of the thin biotype and recession, and you have to weigh the pros and cons. So sometimes you might say, hey, you already have a bunch of recession. You might get a little bit more, you might not, but it could help in other ways. With anything you do in dentistry, you have to look at all of that. But we can get dental alveolar expansion, which the lower, that's what it is. It's not palatal expansion. So you can get dental alveolar expansion really at any age. It's just a matter of how slow the forces you use and the mechanism that you use to accomplish that.
And sometimes we joke you need teeth and a pulse, right? to do the to get
Yes,
that.
you do need teeth. You can't do it when they are edentulous.
Right, right. Do you implement myofunctional therapy with every expansion case and or every ortho case? And then they added, I find this so helpful for optimal outcome.
So I do. That's my goal. I do think about the good enough dentistry approach. Perfection can hold you back from greatness, but I try to reach that, and I explain to parents that myofunctional therapy is part of that root cause. So the cause of the underdevelopment is muscular dysfunction. So we need to address that muscular dysfunction, and we need to train that tongue. So I recommend and I refer every patient for myofunctional therapy, because if they need this work, they have muscular dysfunction. They usually have a tethered tissue of some sort. Maybe some don't, and they just have, low tongue posture, which would be rare in my opinion. But they have muscular dysfunction that's held back or impaired their growth that we need to train. Sometimes if I have a patient that financially cannot afford a full program, I know my therapists are really great at working with them when they can, but we have used some myofunctional appliances as trainers to help, and it's better than nothing. But every single person is going to get some form of muscular training and habit correction and nasal hygiene and all of that. You need to address the force that you can't remove from their mouth. So I always talk about the muscles, the tongue being your best or worst orthodontic force. And so you can't have them in treatment forever. Their body needs to take over at some point. And if that body is working against you, you're gonna have relapse, and you're gonna still have a child that's not as healthy as they should be at the end of that treatment plan.
Thank you. Have you completely switched your office out of general dentistry to only Airway? And if so, are your patients only pediatric?
Yeah, so it's been a process. I've been working on that, and it's hard because I do love general dentistry and I love my patients, and I've worked really hard to build this practice. But luckily I have an amazing partner that is helping take over the general dentistry side. So I own Dental Partners of Vero Beach, which is a general practice, and I've been there since 2011. And as an associate, I bought in and changed the name in 2015 to Dental Partners. And that was my goal of, just being a general dentist forever. And we actually designed our practice very concierge spa, like fee for service, like not super kid friendly. We have waterfalls and all these things. And then right after I built it, I just took off in this pediatric space. So we added a little kid area in the corner. And I did have a pediatric dentist for a little bit working with me, but I found it hard, at least when I was building, to find someone that treated the children with the same eyes that I do. And so I found that I was missing a lot of patients that needed help that were in my office. So I said, you know what? I'm going to take over the kids. I kept trying to pass that on to other doctors. And unfortunately, unfortunately, I have a gift for seeing children and for identifying these things. And so more and more, I just started taking over the kids, and even doing a lot of the restorative on the kids, because I have the ability to manage them, because I manage them with the orthodontics. I manage them with the tongue ties. So if you're doing tongue tie releases on infants and above, you do have very good patient management skills. And so because I'm really good at that, I'm doing it. But my goal is definitely to continue adding more doctors to my practice so that I can only be doing the Airway stuff, which really the only restorative I'm doing at this point would be some fillings on children that may be in active orthodontics with me, and maybe just to make it convenient for them. But I do, try to refer them to if they have an existing provider. But, obviously we do have some patients that they might come from really far away and they are trying to combine treatment or stuff like that. So long explanation, but I'm trying. I have stopped doing restorative dentistry. I said that like 3 months ago. But this week I did a bunch because I have a couple patients that I wanted to finish their care that I may have treatment planned over a year ago, because Foundation First Airway Center is opening next month. So next month, Foundation First Airway Center is my airway clinic that's within Dental Partners. So Dental Partners it's a two floor building. The second floor is Dental Partners. And the first floor we're building right now as Foundation First Airway Center and Foundation First Education Center. So we're going to have an education room that we're hoping to host a lot of airway education and also just community education to help parents come in, even do, lactation and breastfeeding and all of that stuff, to provide that place that we can collaborate and other doctors can come and be supported, and study clubs. And the airway ortho frenectomies, all of that. I also do like oral appliance. I do medical billing for sleep apnea appliances and all of that. So it's all going to be in that one area in the building. So unfortunately, I wish I could be 4 people, but I can't. And so I'm trying to find other doctors to come in with me and to do some of the things. Is honestly, I could probably just do tongue ties all day. I could probably just do pediatric expansion all day. I could just do the oral appliances for adults all day. But I'm only one person, so I'm still doing it all. Oh, Lauren, you're on mute.
What is the best possible way to get parents on board when they don't see the problem of abnormal breathing or mouth breathing?
So if you don't have a CBCT, I would get a CBCT. I did try to do this treatment prior to having a CBCT, and it was very challenging because first I felt like I wasn't able to fully diagnose the root cause without seeing the big picture. So it helped me identify the problem, but it also helps the parents see. Like once they see that, they're like, oh, this is obvious. I can see that vaulted palate. I can see that impaired nasal capacity. And you take before and afters, and really it was kind of interesting once I started teaching this and putting my cases together really organized and having all my before and afters. I started using my presentations in my consults to show patients, and that really helped. So sometimes parents aren't ready, and I don't want to treat those people yet because they need to commit, because they're not just going to an office where you're going to put braces on. They have to wait in the waiting room while you do a wire change. Like they need to be part of this. They need to be willing to address the root cause of the crowding, or else they're not going to be happy with the care and the patient's not going to be fully treated. So you need to make sure that parent's on board. So sometimes I'll just talk to them and say, hey, this is our sleep questionnaire. If they fill it out and it's all zeros, even if I see that that patient is struggling, I know that that family is not ready yet because they're not aware yet. So I just take that as an educational opportunity, and I say, take this form home because I'm seeing some things in the mouth that concern me, that make me think maybe there's some mouth breathing. And then I tell them, my own child, I didn't notice this until I started learning about it. So I bet you some of this is going on. Go home, take a quick video of your child and bring it in next time. Take this questionnaire home. Just get them curious, give them information. And if you like talking to their phone, then Airway Health Solutions will start spamming them on Instagram. So I do feel like these parents, they start, and all joking aside, they start seeing this stuff online when they Google it because you talk to them about it. And now like they start seeing it online, and then, they'll eventually be like, okay, I think this is a problem.
So let's talk a little bit about referrals and collaboration. And I know you're going to address this in your course, but what is the best way to have conversations with orthodontists or other healthcare providers on your findings?
Orthodontists are hard, and I haven't quite cracked the code on that because unfortunately it is seen as competition Like I said, I think there's patients to go around, but it does go against how their curriculum is. And they're the specialists when it comes to aligning teeth. So I walk cautiously with that. But I do have some that, have started collaborating, and that's wonderful. But I really kind of wait for them to come to me, and I just try to be really respectful of the fact that, they're doing the best they can with the training they have, and just kind of gently encourage them to, listen to other orthodontists like Dr. DeLuke, Dr. Christensen, the orthodontists that are doing this, and then try to encourage them to do that. But the other specialists are great. A lot of it is letter writing and communicating and sharing your findings with them. And so as you're starting out and maybe you're not as busy with this, take that time to find out every doctor they see and sending all of those doctors a report, as long as the patients are okay with it, with photos, and making a little kind of PDF drive where they share and say, these are the things that I found, these are the things that I see, this is what I'm concerned with. And the great thing is now with ChatGPT, that's even easier. So you can have AI listen to your consults and then help you draft these letters, where before I didn't get, when I first started out, I didn't get the letters out as much as I wanted. I'm still working on doing that because now I have so many consults, it can take a long time to do that. But definitely the more letter writing and sharing you do, the more collaboration, you will do. And that's very important.
Thank you. I know it's a delicate balance, and you do such a graceful job. How did you advertise the change from going from general dentistry to airway dentistry? And how did your patients accept this? Was it maybe a little bit of advice on that?
I try to be very quiet about it. So honestly, it's just recently that I've gotten loud, because now that I'm faculty and I have lots of cases under my belt, I feel like I have a voice to speak, but I was very quiet and kind of doing it in the closet because I wanted to get that 500 or more cases under my belt, so that I knew that I could say, no, this works. And it's not just something my friend showed me. This is something I've done. And once you see it in front of you, you get more confident. And so until then, though, I was kind of like, I was doing both. I was literally doing as much restorative dentistry as I used to do, combined with doing this. And I'm working two jobs at once because I wanted to keep both going. I wanted to keep my general practice happy. And I've definitely, anytime I pull back, my patients do get a little upset, which I take as a compliment. They really are attached to me. And I feel bad that, I'm stepping away from some of the general dentistry. But that's probably the hardest part for me, is saying no, and realizing that, I can't do everything as much as I really do love it. I've run into some doctors that have gotten into sleep medicine because they don't like restorative or they don't do it. And that just wasn't the case for me, and so that's been hard. But my patients have seen, the ones that have been with me for a long time, they've seen my growth. We share the podcast, we share all the things on our Facebook, and we talk about it when we come in. And most of them are really proud, and they're very excited for what we're bringing to the community. And we're having an open house at the Foundation First Airway Center next month, and we're inviting everybody. We're making it a big party, and we're just constantly talking about, and my team, my hygienists are really advocates for what we're doing, and everyone sees the change every day. Honestly, airway dentistry has changed the entire culture of my practice, and for the good. And I think a lot of us struggle with staff issues and morale issues, toxicity in the workplace, and I was no different for a long time. And what I found is, once I got really good at this, staff members rally around you, they support you, they want to be part of your practice, because you're changing lives every day. So we know that our generation now, not only do they want a paycheck when they come to work, but they want to be part of something great. And to give them an opportunity to be part of your office when you're doing this is such a gift, because you're not just a regular dentist, you are changing lives every day. And these people get to be a part of it. And honestly, the culture's never been better. And because they all believe in it, if a patient says anything, they'll just go on and on and on and on, kind of like I am now, about how amazing it is on what you're doing. And the patients, they get excited. I've had patients that want to sponsor kids. And we've thought about doing that. And then we're going to work on something like that where they can, donate a certain amount of money and that could go towards helping a child. And so that's all stuff in the works for me because I have a lot of very generous patients. I've done full mouth reconstructions on them and veneers 15 years ago. And they say, how can I help a child? And I tell them there's so many children that need this that don't have the help. And so that's another thing that I want to do is just how can we sponsor a child? How can we get more children the help they need? Because unfortunately, medical insurance doesn't cover it, even though it's a medical problem.
I know. And it's funny that you say that because I'm trying to get up this, some of the updates and the Airway dentist locator. But just today, someone called me looking for you and trying to find you, for like an hour away. And I had them just go to the locator because the work that you're doing, it's spreading and you're going to keep on having more and more patients looking for you. And that's why we have such opportunities in dentistry for everyone to do what you're doing. And I truly think that it will make the world a better place and we can change healthcare as we know it. I just want to make sure that everyone sees my full screen. So we have so many questions, Dr. Schwibner, on how people can do what you're doing. And that's why we created this coursework. And I'm so excited to share and so thrilled that you're on faculty because we really need like thousands of these dots so everyone can get the customized care that they deserve. And how to get on the locator and how to become an airway dentist is we start off with the mini residency with Dr. Ben Moralia. And then you would consider going to Dr. Jenna Schwibner's course for an intermediate integration type of pathway. We also just hosted Dr. Kotwa's and Dr. Liu's pediatric airway and sleep health where form meets function. And that was just such a wonderful resource for everyone to really collaborate with the medical community. It really goes hand in hand with your implementation course, Dr. Schwibner. So we're really excited to offer some of these new solutions. But I really want to focus on your course this evening because you've put so much work into it. And I want everyone to hear from your words, from your passion. You spend so much time and you have such passion on paying it forward. Give us a little bit of an overview of why you put this course together and then what people can expect from taking it.
So I love making things simpler for others. It's funny, if there's anyone that went to dental school with me on here, I was the nerd that took the notes from class and I made study guides and I passed them out to everyone. I don't know. I always loved teaching. I loved helping other people be a better version of themselves. It's just a passion of mine. And that's part of why I love doing the dentistry I do is making better humans. And that's better doctors. That's better healthcare. It's a better world. And so I realized that, I took all the different courses that we had to offer, Dr. Boyd's, Christensen, Moralia, and then I'm like in the real world, I'm doing this and I'm working and fine-tuning my systems and developing these systems. And I'm getting questions all the time as I'm sharing things online. I'm getting doctors messaging me all day after day, asking questions. And I just started compiling. I'm getting the same questions over and over and over again. And I said, Lauren, people aren't implementing this the way that they should. Why is no one else implementing this? I did this course, I'm implementing it. And I realized because it's really hard. And these are the issues people are having. So I said, okay, I am going to make a course to answer all of these implementation questions I'm getting from everyone. And so I just started compiling for the last few years, just any question someone gave me, I'm like, here's a solution, right? So Airway Health Solutions. You have a question? Solution. And it just kind of grew into this like step-by-step guide of solutions. And there's a lot in there. I kind of, every time I develop it, I'm like, oh my God, I could talk for a whole day just on this. So I think there's a ton of pearls and a lot of it is verbiage. So hopefully that's listening to me rant for 8 or 9 hours each day. It's just that verbiage and hearing it and speaking it. And I want to help doctors do it because I feel like you all can. And there's so many doctors that have taken this course and they're really not implementing it. And so we've got to do it. And then I just want to show everyone how to do it.
We're really looking forward to it. I mean, you've made these roadmaps, these virtual charts, everything kind of step by step. So we're really excited. We love having a live course to kick everything off. That's why a lot of times for our new courses, we will have it virtually live so we can have the energy, we can get the feedback, we can have the live Q&A. So if you're able to join us, we are running this live virtually. It's 2 dates, April 10th and 24th. We are offering $500 for our introductory course price. So that will expire after the 24th. And if many people are so used to these on-demand formats now that they're not used to actually going to a live course anymore, but you can still register, and then these recordings will be rendered fairly quickly. So you can take advantage of the discounts and also, of course, the wonderful information. Dr. Schwibner, you think that this would be a good tool for the dentists then to watch with their team because they will have a year access to the course. Can you touch on that a little bit as well?
Yeah, for sure. I mean, understanding the step by step, understanding how we do a consult, right? So we're talking about how do we do a consult, all different types of expander designs, just to give you an idea that you don't have to do a one size fits all. That's just, we kind of start with that with Dr. Ben because we want to keep it simple, but letting you know, hey, you can try this, try that, do these different things. And really, it's a culture, it's a view of we're not focused on the teeth. We're focused on the person. We're focused on the symptoms. And we want to make the child a little bit better. We want to help the child. So that is the culture that my team has learned from hearing me and seeing me. And I would love for them to hear me and see me so they can be your biggest advocate and rally around you and never want to leave your side because you're doing great things. So share. Yeah, I think the more staff can know, the better.
Wonderful. Any other things you want to share about the course that we might have missed?
I mean, we're going to be talking about class 3s, which I know I really wasn't spoken about in any of the other courses that we have yet. And I was getting a lot of questions about that. And I did some one-on-one mentorship to get that information. And so I am going to be kind of explaining that and kind of our nasal hygiene regimen, how we talk to patients, and I'm not going to go over how to do eye tongue tie because I don't have time for all that, but I'm going to talk about how do I refer to the myofunctional therapist? How do we work with them? What's the timing of that we've really developed with my myofunctional therapist? That's incredible. And how we communicate, right? So how do we communicate to them? How do we communicate to the other specialists? It's really helping you understand how to connect those dots and then, there's going to be more and more. Like Lauren said, I just feel like we could do a whole course on just a consult. But this is just to touch the surface. And then we're going to be here. I do one-on-one mentorship and I do, we'll do some adult courses, even just talking about how to do a consult on an adult, how to talk to an adult, all that stuff will be coming. So, yeah, I'm just excited to share all my secrets with anyone who wants to listen, which is probably anti-business, but I'm here to do it and help you guys just be better.
We really appreciate that. And we also wanted to just share with you the new courses now available on demand with Dr. Katwa and Dr. Liu. And it's a phenomenal way to, if you take both of these intermediate type of courses, just to help you integrate this. It's really to roll up your sleeves with the roadmaps and the next level of how to. So we're really excited to offer these new courses for you and help you take advantage of that. We do have our adult pathways as well. So next week, we're going to host Dr. Andy Cohen, and he's going to talk a little bit more about metabolic health because there's a lot of curiosity around that with his case. And then we also have our electives that we just have tons of solutions, and we're working on more digital solutions right now to implement more of these systems. And of course, we have our School of Myo for our myofunctional therapists, dental hygienists to learn more and to also have new electives coming. So stay tuned for that. And here are some of our coupon codes. We are offering $500 off of our foundations of pediatric airway health. If you're new to this, you may just want to start with the foundations course. So that's a really deep savings for that course, as well as a $500 off the pediatric mini residency with Dr. Ben Moralia. Those would be your starting points. And then you would continue on with Dr. Jenna Schwibner, more of the intermediate course. Airway Palooza, just want to have everyone have this on the calendar. We're going to be announcing our speakers soon, so we're really excited. We have the top speakers, but we do have an early bird special. It's going to be April 22nd to 24th, 2027, so next year, but mark it on your calendar. And a lot of people are taking advantage of this deep savings because we will be sold out. So we do also offer payment plans interest-free. So check us out and stay tuned for some exciting announcements. We will be in Houston as well, so that's something you may want to consider. And we will be in the PANI, May 7th and 8th on Long Island, and also Pittsburgh, May 15th and 16th for the AAPMD. We will send some of these follow-up codes so everyone can take advantage of some savings, as well as the World Dental Sleep Society Symposium in Baltimore. So also want to just always give a shout out to Children's Airway First Foundation. They have great resources as well. So take advantage of that. And hopefully we will see you guys next week to learn more about our conversations, and please feel free to share with your colleagues. But before we go and do the raffle, I just wanted Dr. Schwibner, please close us out, because you have a platform now, your voice is being heard, and I can't wait for everyone to take what you've learned now, take to the next step, and then we'll get them on a panel discussion to talk about how you changed their lives and their patients' lives. And you have patients like Jaden, your own children, the work-life balance, all of it, it's doable. And I just want to give you the final closing statements, and then we'll do our raffle.
Yeah, so I typically will close with, be brave, and we're all become doctors. We all get into healthcare because we want to make people have better lives and improve their lives. And there's no better way, in my opinion, than Airway. And Lauren said something very interesting to my partner, who's a general dentist and wants to stay in general dentistry. She said, you are an Airway dentist also, because you're supporting this culture in your practice, and you're referring to Jenna, and you're collaborating with Jenna because she doesn't need to learn how to do this because I'm doing it in her building. And that's what everyone here can do. So some of you might say, you know what? I don't have the ability to implement this, or I don't want to implement it to the extent that you are, but somebody else around you can, and you are going to be part of the solution. And every single patient that comes in, it's funny because if I do a hygiene exam, which I try not to do too many, or I wish I could, but I don't do that many. But when I do, we always talk about Airway. Every single adult patient, it does not matter if they are in there at hygiene, we always end up talking about it. And it is everywhere. And so I just challenge you, at the very least, have the conversations in hygiene, because I had a patient just yesterday. I did do a hygiene exam on him. I saw him a couple of years ago, and I just talked to him about his sleep because I saw the warning signs in his mouth, and I got him to do a sleep study, and it came back severe apnea. He's now lost 65 pounds and he no longer has apnea. And I tried to get him to do expansion, and he thought about it, but he didn't do it. But he lost weight, and he started taking care of himself, and he was starting to get early signs of dementia, and he no longer has that because he wasn't sleeping. He had that brain fog, and his wife was my patient, and she thanked me for it. So they said, we're really sad you're not doing our hygiene checks much anymore, but we wanted to let you know that you saved his life just by talking to him in hygiene and getting him to get that CPAP. And then he lost the weight, and now he no longer needs the CPAP. So you can change the lives just by getting to know your patients, and that will make your practice better because those patients will never leave your side, and you don't ever have to do anything other than just add it to your hygiene exam. And I love it when patients just do that, or doctors just do that.
Well, thank you. And we're super excited for your course. And let's go ahead and do the raffle, and then we'll say goodnight. Jay, I'll let you take the wheel here. Okay, so the winner will have the Foundations of Airway Dentistry course. Let's see who's the lucky winner. Okay, Cindy Lazo, congratulations. That's a $900 value, so we're really excited. And hopefully you'll get started on your journey. That's how Dr. Schwibner got started, I think, just seeing one of those intro courses and being curious. So stay curious, everyone. I know you're on here because you are curious. You guys are the change agents, and we're so appreciative of you for joining us this evening. Please continue to pay it forward. And Dr. Schwibner, you're paying it forward in great strides. And we're so appreciative, and we can't wait to launch your course. And we're so honored for you to be on our faculty. So thank you so much.
Can't wait for Friday. Hope to see those of you that are on here there. Just so excited to be able to answer your questions and just help out more people.
Okay. Until next time, we'll see you next week, everyone.